Joining me for this Tell Me More session is Raffaele Cavalcanti from Italy. Raffaele, welcome.
Thank you, Gary. It is a pleasure for me to be here.
Let's dive deeper into the topic of long-term stability of soft tissue, which you are an expert in. And let's start at the basic. What is now, in this Milan Congress 2024, the key challenge or lectest insight when we talk about soft tissue stability?
Soft tissue topic is something that quite new in our congresses, in our lectures, but it's something that more and more, day by day, is having more emphasis and playing a very important role. As all our therapies, our treatments, the result, the significant outcome is not that one that we can get immediately after rehabilitation, after replacing one or many teeth by means of implant-supported crowns, but the long-term result and long-term stability.
Exactly. So you say it's a novel topic. I guess the whole field of implantology is relatively young. So we started with the basic, the osseointegration, the stability, the looks, and now we start to realize the soft tissue is actually more manageable than we think. What is important to keep in mind when we look at good outcomes in the long term?
We have to keep in mind that, first of all, we are treating patients. We are taking care of them. Some of these patients also comes from history of diseases that are the main cause of their missing teeth, like periodontitis. And so our target, our long-term target needs to be health. In this case, peri-implant health, by means also of keeping as more intact as possible the peri-implant surrounding tissue.
Yeah. Which is kind of contrary, because one of the things you do when you place an implant is quite a heavy surgery, quite heavily damaging the soft tissues around, so everything needs to first heal and then also look nice. What are some of the key challenges there? The key challenge now is to match the tradition. So implants were born to stay, to be housed in bone. And we thought for many years that bone by itself was sufficient to keep implants long term. Then we understood that also considering the changes, the anatomical changes that occur after tooth extraction, we need to find a kind of compromise in order to maintain the overall tissue volume. Yeah. And so if we consider that time after time, bone has a tendency to resorb a little bit in an horizontal direction, but also in a vertical direction, increasing soft tissue thickness is a way to keep the overall tissue volume and to give stability, not only on a superficial aspect, so the mucosal margin, the gingival margin, but also to give protection to the bone that is beneath the soft tissue. And do I understand correctly that you're saying that the soft tissue or the additional soft tissue is actually supporting the stability as well?
As well, yes.
Exactly.
The stability of the margin of the soft tissue itself, but also preventing peri-implant diseases and bone resorption.
Further bone resorption, yeah, exactly. So I understood you brought some images to actually help us understand better. Please talk us through.
As we can see in this clinical case, we sometimes need to treat some very challenging situation.
Yeah. What is specific about this case? Help me look at this.
Some clinical situations that really have a dramatic impact on the also social life of a young girl that is suffering from loss of an upper central incisor with a major loss of bone and soft tissue.
Exactly. So we're dealing here with the aesthetic zone.
Yes.
Afraid to smile. And you say it's a large defect, both in bone and soft tissue.
And
you can easily see.
We call it a through and through defect, so with an horizontal and a vertical component.
at the bone level, as you can see here, we have an empty hole that we have to fill in some way in order to place an implant and have a tooth there.
Exactly. So walking around in EAO congresses for years, I immediately think, bone augmentation.
Bone augmentation.
We fix the bone and then what? But now we talk about soft tissue. What is important to understand about soft tissue?
In this case, we utilize soft tissue graft in 2 steps. The first step, in order to increase soft tissue volume, to allow us to perform a bone regeneration procedure. And then at second implant surgery, that is the fourth surgery in this case, when we connect the implant to the prosthetic components, a soft tissue graft gave us the possibility of establish an ideal contour to have a real soft tissue thickness augmentation and to change the phenotype of that site, the soft tissue phenotype. And so we can, as you can see here, we can make a comparison between the baseline, the initial situation, and the end of the treatment. And we were talking about stability, long-term stability. In this case, we have the 5 years follow-up with everything stable, both as at the bone level, but mainly at the soft tissue level that is so important in an aesthetic area.
And you say the novelty here, just to understand you super clear, is the 2 times soft tissue augmentation in these steps.
In this
so
case.
First at the first initial surgery, and then again when the implant and the prosthetic are placed, and that's new.
Yes, in this case, the first surgery for soft tissue augmentation was aimed to have enough tissue to move and to perform the bone regeneration procedure.
Mm-hmm.
And the last step, we evaluated the residual soft tissue contour, and so we thought that a new soft tissue graft could be really very beneficial for the optimal final result.
Okay. So I start to understand it's a key message to have a better eye and focus on soft tissue. Perhaps be as brave to actually do soft tissue augmentation, even twice in a protocol if it requires. What are some of the challenges or risks that clinicians need to be aware of when they think, nice protocol, Raffaele, I'm going to try to start to work like this?
This procedure is not as common as we can thought. In this case, really, all the steps were part of a complex treatment. But one suggestion that we can give mainly to our younger colleagues is that they have to be really more precise during their surgery, knowing how to move superficial tissue in order to close the primary closure on top of bone regeneration process, and to have a very deep knowledge of biology and of healing processes. So it's something that is part of a learning curve or course. Our colleague, the youngest, I know many of them that are very talented guys.
But the warning here is you say, wait a second. Yes, you are a surgeon, and yes, soft tissues in the oral cavity heal fast. Yet you should be very careful because you have long-term effects.
Yes, absolutely.
Good message. Anything else we need to keep in mind when we focus on long-term stability, specifically of the soft tissues?
Specifically related to soft tissue, we are doing also some researches in our group too with Professor Cairo in Florence. We are evaluating the possibility of replacing the autogenous graft harvested generally from the patient palate with some substitutes to replace soft tissue and to avoid a second wound in the mouth of the patient.
Yes.
But I think it's too early to tell that we can take something from a box, open it, and it will work the same way than autologous tissue. Mainly in critical from several aspects situations in aesthetic zone, when we want to really increase the soft tissue thickness, changing the phenotype, and maintain this type of result long term, connective tissue graft, autologous tissue is still the gold standard. The new perspective, the new technologies are promising from several aspects, and it has to be our job, our effort to find a specific indication for new technologies.
Exactly.
But we don't have to forget not only the history, but the historical principles of wound healing, of soft tissue healing in this case, and how also these tissues, the augmented ones, behavior in long term. This talk is called "Tell Me About."
Exactly.
I can add. We
can talk for hours.
Yes,
about that.
I can tell you the truth.
Yeah.
We have to understand that nothing is identical and can replace perfectly a natural tooth. So we have to find the best possible compromise.
Yeah.
When we place implants, we try to convert a site that not having the tooth anymore completely change its vascularization, for example, its behavior, generally speaking. And so all the tools that we have at bone level, bone augmentation, and soft tissue level are aimed to create a wonderful compromise.
As close as it can get. But it will never meet and met reality. Yeah. Exactly. Thank you so much, Raffaele Cavalcanti, for explaining and tell us more about focusing on the long-term stability of soft tissue, the importance of having attention for it, the carefulness we need during surgery, and also be aware that we're also always still working on a compromise.
Thank you, Gary. Once again, it has been a pleasure to be here with you, to be here for the EAO Congress. That is really a wonderful and amazing event.
Thank you.